You're listening to the Mind Flipping Podcast, where you'll find tools and tips to help you renovate and update your mind and life.
Richard, you've been using hypnosis, mindfulness, coaching for a few years, well, maybe more than a few years, to help other people flip minds, help them renovate and update their lives. And my experience has been a lot of hypnotists, those in meditation and coaching, use it in their own life. Do you have a personal story of a time where you've had to change habits, kind of renovate, improve your life?
Yeah, well, I actually started doing hypnosis more than 30 years ago. And what's interesting is that I accidentally learned hypnosis. And so in graduate school, in the counseling program I was in, I was randomly assigned a clinical supervisor who turned out to be a PhD psychologist who was an Ericksonian hypnotist. And so he taught me hypnosis. And now, again, this was more than 30 years ago. In fact, when I was working at the hospital in inpatient psychiatry at that same time, we would actually do report in the nursing station for each shift. And all the doctors and nurses and therapists would all be smoking their cigarettes while we did report and talked about our patients. Those who are familiar with the Dave Ellman induction can actually find videos of Dave Ellman using his cigarette as a tool for hypnotic induction. So we all smoked, and it was probably about 10 years after that. And my old clinical supervisor from graduate school called me and said, "Richard, do you still smoke?" And I said, "Yes." And he said, "Oh my gosh, that's horrible. We all quit. We all have to quit smoking. No one can smoke anymore." He said, "Come in next Thursday morning. I have you down. You have a hypnosis session with me because there's no more smoking." And so I actually used hypnosis as a tool to help me quit smoking. But I've used hypnosis, again, in a lot of different ways. I used to be afraid to fly on airplanes. I used to be afraid of driving in big traffic. I used to be afraid of elevators. And now I fly as often as I can, as far as I can possibly go. And being executive platinum on American Airlines, my executive platinum card is my most prized possession because it's sort of like a diploma that says I graduated from fear to exploring the world. And so I've used hypnosis in many ways in my life to change things. Even this past week, I felt like I could get the flu. And so I decided that instead of feeling like I could get the flu and wonder if I would get it, I would use self-hypnosis as a tool for going to sleep early, getting a good night rest, taking care of the things that help you to feel better, encouraging me to take care of my immune system and my health, and to step into a state of health rather than a state of anxiety about getting sick. And I never got sick this week.
That's awesome. What else is awesome is you kind of answered a question I had before I asked it, which was, I think a lot of times as hypnotists, as coaches, people will think, "Oh, we've got it all figured out. Yeah, you cleared up all those things in the past, the smoke, the smoking and the fear of flying and fear of driving. So you should be good to go." But stuff still comes up, whether it's fear of getting sick or whatever.
Yeah, our goal in life is not to be perfect; it's to make progress. It'll take me a lifetime to be perfect, and then I'll still probably only come back as a dog at best.
I like it. And as you started to tell the story of when you got started a few years ago about working with the nurses, one of the processes that you taught me that's very simple yet very powerful that I don't think enough people are aware of, I believe you were taught by a nurse or nurses, which is autogenic training.
It was actually those nurses in that inpatient psych unit. Back then, all the nurses had blue hair, right? And the way you became a psychiatric nurse was you worked so long and hard for so many years at the hospital that now you got to work psychiatry. Because for the most part, the psych patients didn't have to be lifted. The psych patients didn't have to have an enema. The psych patients weren't throwing up. The psych patients didn't have communicable illnesses. And so it was sort of an award to become a psychiatric nurse. And so all of the nurses had blue hair. All of them were named Mary. And they were the nurses who still wore hats and chain smoked during report. But I was actually hired for an interesting reason. I was hired for second shift, and I didn't know when I was hired. It was a rather sexist reason. They only hired me for one reason, and that was to have male presence on the second shift. Remember, I wasn't finished with graduate school yet. So I didn't have a job. I mean, they hired me just to be the man on the unit on second shift. And so I got bored quickly because I basically was reading and talking to the nurses and, hanging out. And so I said to Mary, the lead nurse, I said, hey, I've been studying hypnosis. Can I do a relaxation group for the patients every night? And she said, yes. She said, that'd be great. So every night I scheduled an 8 o'clock relaxation training session with them. We didn't call it hypnosis, we called it relaxation training.
Right.
And I did all kinds of things. I did traditional hypnosis. I did, progressive muscle relaxation, all these things. And one day Mary came to, and a lot of times I would just play a cassette, right? So one day Mary came to me and she had a cassette and it was handwritten and it just said autogenics on it. She said, Richard, you should try this in your group tonight. So I put that cassette in and I laid there on the floor next to all the patients and I followed the processes, and it was the most profound hypnosis session I've ever had. And of course it was autogenic training. And autogenic training was an idea that came from a German psychiatrist in the early 1930s. And it's based on a meditation technique, but it is largely taught and utilized by nurses, not by therapists. But it is a fascinating way of creating within oneself resource states. Well, that's what hypnosis or self-hypnosis is all about. And so I became very interested in autogenic training. I read all the nursing journals I possibly could on the subject. I read everything I could that was outside of the U.S. because most of the attention, I think, to autogenic training has come from outside of the USA. But for 30 years, I've used it as a core technique, both in my induction and as well as other components of hypnotic suggestion. Because if we can create warmth and heaviness, well, can we create acceptance and satisfaction, or can we create abundance, or can we create an absence of withdrawal and a presence of calm? There's so many things we can create when we learn to activate within ourselves our greatest potential.
So in addition to using it as an induction, and in addition to using it as an awareness that we have the ability to create, how else is it practical as you see it?
Well, I think it's real practical because unlike most hypnosis sessions where a hypnotist merely talks to a person, it creates two-way communication.
Sure.
It's an active process. The person who I'm working with is doing something. And when they become fully engaged in a hypnotic process, they become fully engaged in and acting on any of the suggestions I give, whether they're autogenic suggestions or direct suggestions or metaphorical suggestions or anything else. And communication becomes a two-way street rather than a one-sided way of communicating with a client.
Fantastic. And so, whether it was 25 or 30 years ago, you learned this autogenics training, and how many years after that did you recognize that this is actually a form of mindfulness? And second question, how did you come to the field of mindfulness?
Well, I think that I knew right off the bat that it was a form of hypnosis. The mindfulness as a buzzword in the therapeutic community and medical community is probably about 30 years old.
Okay.
That's when John Kabat-Zinn began using the word with his patients at Massachusetts General Hospital in the pain control treatment program. And shortly thereafter, his successes in teaching his clients a non-religious form of mindfulness meditation, sort of took off. And he, sorry about that. I usually turn my phone off. I can't find it to turn it off. So.
That's okay.
It's officially gone. Sorry about that. I've turned it off.
No problem.
So it didn't become a buzzword, though, that everybody knew probably until 15 or 20 years ago. And as soon as people started talking about mindfulness, I thought to myself, well, I have to explore this. And then I discovered that mindfulness is really just another word for hypnosis. People try to tell me to come up with a differentiation between hypnosis and meditation. I've tried to come up with a differentiation, and there really isn't one. I mean, we can try to parse words and come up with semantic differences, but the reality is meditation is hypnosis, and hypnosis is meditation, and it really is one big umbrella with a bunch of different words.
I agree. How would you say, so I know you are big in both of those fields, hypnosis, meditation, as well as coaching. If meditation, mindfulness, and hypnosis are all the same thing. Where does coaching fit into the picture?
Well, coaching fits into the picture because people don't know what they need to do in order to make something different. We only know what we know. Nobody has a screwed up life or a whole bunch of problems because they want life to be like that. I've never met anybody yet who said, hey, Richard, I would like to schedule an appointment. I'm 52. I've been divorced 3 times. My kids hate me. I got fired from my job. There's a protective order against me. I drink too much. And I live in a van down by the river. And the result is I just want to come in and process with somebody the fulfillment of all of my life goals. I've never gotten that call. Instead, I call me up and they say, I'm 52 and life is screwed up and I don't know how it ended up screwed up. And people only know what they know, and they literally don't. Most people don't know what they need to know to solve problems. So let's just take insomnia, for example. I see a lot of people who say, I just can't sleep. I can't sleep over the night. It's my dog, by the way. My dog is doing a good job of mindfully guarding the door. But people say to me all the time, they say, I can't sleep. And the reality is they need to learn how to sleep. So self-soothing is something we learn as children. But when I talk to people, they didn't learn what they needed to in their family and in their childhood. And they don't know how to self-soothe. So now at 52, they haven't slept for the last 30 years. And the reason why is because they don't know how to put themselves to sleep. So I'm literally teaching skills to 40-year-olders and 50-year-olders and 60-year-olders. That doesn't mean that they're not good people. I mean, I missed out on a lot of skills in life that I now recognize, I need. And fortunately, I'm surrounded by good people who can help me find them. And the guy who's apparently cutting my lawn.
You've got a lot of people helping you. I love it.
Right. My dog is guarding the door from the guy who's cutting my lawn now.
What a team.
Right.
So as you describe coaching now, it's a little bit different than I was originally described coaching, in that coaching doesn't really teach somebody, doesn't tell somebody how to do something. Coaching is supposedly more a process of asking questions and finding out, letting the clients figure out their own answers. What do you say about that?
Well, I think, that's an insight-oriented approach, and that's fine. People generally have the tools within them to solve most problems. But I think coaches also teach. Mm-hmm. I think back to when I was a T-ball, and my coach taught me how to hold a bat. My coach taught me where to stand in relation to where the tee was. My coach taught me how to hold the glove to catch the ball. So there was always an element of teaching in effective coaching, even if ultimately the goal is to draw on the resources that are present. Well, sometimes you have to teach somebody then how to apply those.
I agree. One of my main motivations behind starting this podcast is to get a greater awareness to these fields of hypnosis and meditation and mindfulness and coaching, that they're wonderfully powerful to help anybody renovate, update, improve their lives. Yet there's a lot of myths and misconceptions about all of them. And one of them, I was sharing with a client recently, that one of my first coaches had the impression and was taught that coaching is about asking questions, and she wanted to share, she wanted to tell, she wanted to teach, but didn't. And in a short time, she got lockjaw from not expressing what she knew.
Right.
So I agree. And that's one of the things I love about you and working with you. You have a nice balance of bringing it from within us as well as sharing your personal experience. So I appreciate that.
Questioning is a way of helping my client to often adapt new ideas from a new vantage point. So questions have a place, but Lucy, remember the Peanuts cartoon, and Lucy had her psychiatry for 5 cents. Mm-hmm. People wanted to go see Lucy and pay 5 cents. And the reason why is, Lucy gave advice. Dear Abby was so popular in the newspapers for many years. And why was Dear Abby popular? Dear Abby, my husband is a jerk, and, he loves the dog more than me, and he bought the dog a birthday present but didn't buy me one. What should I do? And then Dear Abby would say, well, you should dump your husband and leave him with the dog, right? Why was Dear Abby popular? Because she answered the damn question.
Right.
I think in therapy there has been too much of an emphasis on because I was trained in therapy. I'm licensed as a marriage and family therapist, and I was trained in therapy in some of my components, to never answer the question. And I realized that's why people like to go to a hypnotist or a coach or a meditation instructor rather than a therapist, because kind of like Lucy or Dear Abby, we'll at least answer the damn question.
We'll get to the point. We won't waste time.
Right. Yeah, I talked to a guy yesterday who called me. He wanted to know about scheduling an appointment with me for erectile dysfunction. He had made a couple different calls. He said he's been married 9 years. This is destroying his marriage. His wife is absolutely fed up with him. He has to find a solution. And he was bummed out because he'd actually talked to a psychologist who told him that he would see him and do cognitive behavioral therapy, and that probably within a year he should be able to find some resolution. And I told him that I've seen a lot of people with the exact same experience that he has, and I typically see them for 3 sessions. And
what was his response?
His response was, "Is that possible?" And I said, "Yeah, go to scholar.google.com and type in erectile dysfunction hypnosis, and you'll pull up the peer-reviewed literature to show that hypnosis is an effective intervention for this."
So true. Fantastic. So one of the things, Richard, that I respect about you is your ability to grow and learn and change. You have a vast knowledge in a lot of different areas. What are some of the things that excite you recently? Some new things you're changing in your business, or changes in the field of self-help and therapy?
Well, for the last 2 years since I moved from Tulsa to Las Vegas, I wasn't seeing clients because I had throat problems and voice. I had throat surgery, 2 of them, which is why I keep my big iced tea nearby.
I like it.
I don't lose my voice anymore. My voice is back, but I had a hard time speaking, so I couldn't see clients. So I've opened my office, Nevada Hypnosis, here in Las Vegas a couple months back, and I'm back to seeing clients on a regular basis, and that's really great. I've been studying Chinese every day, and so 2 years ago I couldn't even say ni hao, and now it's Chinese New Year this week, and so Shen Yan Kuai La, and I can speak Chinese pretty well now. And the interesting thing about that is they say Chinese is such a hard language to learn. Hypnosis is a great tool for helping us to enter into a learning trance, whether we're trying to learn a language, or whether we're trying to learn a new skill for work, or whether we're trying to learn new technology so that we can, use the internet in the way that it's utilized in 2018. And so applications of self-hypnosis to my own experiences are things that I still continue to enjoy and benefit from.
That we just heard is the sound of speckling. Perfect timing, because it is now the speckle round. It's time to fill in some holes. And so as you are talking about your ability to learn Chinese, do you have a word or phrase of the day?
The phrase of the day would have to be the phrase of the year, and that is Jiao.
Jiao.
Jiao. So Jiao means come on, you can do it. I'm cheering you on. And it's become real important because I've made a lot of changes in the last year, and some of them have been pretty challenging, ranging from health to other issues, and that phrase keeps coming up. And in my family, been like anyone else, some challenges and other situations. And so the result is that encouragement of other people is important. And since I've been studying Chinese, Jiao is the word of the day, or the word of the year.
Jiao. I love it. All right. Speckle round question number 2. Is there a common belief in your field that you disagree with?
Yeah, the most common belief that I disagree with is that we must go back to the past. This was the idea of Sigmund Freud in 1898. In order to resolve the problem I have in the present, we have to understand why and look for the initial sensitizing event. And that was the idea of Sigmund Freud and Jan Brewer, and it was popularized in the 70s or in the 60s by primal scream therapy. And the reality is that mainstream psychology discarded the idea. In fact, Sigmund Freud discarded his own idea of regression as being important. But for some reason, hypnotists continue to persist in believing that is the best way to help people resolve a problem, hypnotize them, bring them back to the past. But the reality is we can't go back to the past. All we have is the present. So the great master Oogway said, yesterday is history, tomorrow is a mystery. All we have is the present, and that's why it's a gift. So I don't need to revisit the past. I don't even need to understand the past in order to make a change today. And approaches in counseling, coaching, hypnotherapy that focus on the present are infinitely more effective than the idea of Freud and Jenner and primal scream therapy. Now, sometimes people say to me, but it works, I've been doing it. Well, there's also plenty of literature to show that the most important thing in a helping relationship is, do we actually care about the client? And does the client believe that we care about them? So people can use ineffective methods and still produce results. What that actually means is that despite the fact that it really actually means they're an awesome person. Right. Because even though they're using methods that have long been discarded and have no external validation as a valid therapeutic technique, their clients do get better. Well, that's a testament to their empathy, to their compassion, to their ability to build meaningful relationships. But imagine if we took those skills and then added contextual psychology, the methods of third wave behavioralism to our hypnosis and coaching that we know are effective methods for making change. Well, then we can even expand to an even greater level of potential. So I'm definitely one of the hypnotists who comes from an entirely different theoretical perspective, but the theoretical perspective that I have is based on the research of what actually works. And when I have a new client, someone I've never met before, I want to use not the intervention that I'm most familiar with or the one that I learned a long time ago. I want to use the intervention that's most likely going to help this person now. And then I'm going to go from there into experiential and experimental approaches. And
you decide which approach is most likely to help them based on your experience and the latest research?
Yeah, I keep on top of the journals. I'm actually a professor at City Vision University. I teach the counseling program there. I read journals on a regular basis. Most people don't for some reason, probably because they're kind of dry. But I keep on top of it. I'm fascinated and interested. We have 100 years of peer-reviewed literature. Hypnotists still wonder, does hypnosis really work? How can I prove it to people? There's 12,000 peer-reviewed journal articles showing the demonstrated efficacy of hypnosis. That does not include meditation. There's been piles and piles of research, hundreds of thousands of articles on meditation and its effectiveness and helping people make change. But these articles not only show us that hypnosis or meditation is an effective tool, it actually shows us what methods are the most effective. And when we understand that, then we can choose those things that are most likely to be beneficial to our clients. So one of my favorite approaches comes from acceptance and commitment therapy, or referred to as ACT therapy. And if you're a hypnotist and you read about ACT therapy, you will quickly recognize that even though they never use the word hypnosis, these are all hypnotic methods. And those approaches are infinitely beneficial to the clients that we work with. And those are my first approaches. If regression has value, it's not because it helps my client make a change now. Its value is actually at the end of therapy. So let's say a person overcomes their fear of flying, or quits smoking, or stops stealing hubcaps, or in the case of my dog, quits chasing cars.
Right.
Now that we've made the change, we can go back and look at why did I do that, and we can avoid relapse. So it can become a relapse prevention tool, but too often it's used by hypnotists and coaches really as the tool for change. I want my client to stay focused on the present, not the past. I call regression therapy past tense therapy, and it really is.
Yeah. So rather than being a protocol to use in the first or second session, it may be a third, fourth,
yeah, exactly,
fifth. Yeah.
Yeah.
To kind of clean things up.
Right, exactly. Now we've done the work. Let's go back and avoid relapse.
Right. So for somebody who continues to read the latest research, you've undoubtedly changed your mind about a lot of things. Is there anything that pops to the front of your mind, a belief that you thought you would always have that you no longer have, professionally or personally?
I can't think of anything offhand, but
Okay.
I'm sure I'm always discarding old ideas.
Yeah.
I think, I think that probably happens to many people just as they get older, because they get more experience. I tell my kids things, they're in their mid-20s. I tell my kids things that they should be doing based on my experience in my 50s, and I know that they still have to do it the hard way sometimes.
Right.
And,
Right.
and we learn they say that good judgment comes from experience, and experience comes from bad judgment. So
I like it. I think I heard that recently. I like that. So another hole to fill in, you quoted a very profound master.
great Master Oogway.
Oogway. And who's Master Oogway, and what was that phrase again?
The great Master Oogway said, "Yesterday is history. Tomorrow is a mystery. All we have is the present, and that's why it's a gift." The great Master Oogway is, of course, the turtle from Kung Fu Panda, and the Chinese word for turtle is Oogway. So, Jishe Oogway, he is a turtle.
I like it. Oogway.
So if you've heard of the great Master Oogway, but you couldn't place it before, it's because
Yes.
you watched Kung Fu Panda, which everybody should watch because it is a very therapeutic movie.
Thanks for the reminder of the profound value in the movie. Another speckle round question. What's love got to do with it?
Love has everything to do with it.
Excellent.
Our greatest need is love and freedom. Everything else is, I think, within the context of love and freedom. By the way, again, this isn't just my own personal thought. It's based on the research. I mean, William Glasser wrote a book in the 1960s called Reality Therapy that said our greatest need is to love other people and to receive love in return. And Robert McGee wrote a book in Christian counseling in the 70s where he said our greatest need is security and significance. And because he was a Christian writer, put that in the context of God's love. A lot of people really enjoyed his book. In the 70s, of course, we had transactional analysis and all these therapeutic groups that connected us to other people. Why? That sense of connection, a sense of love. Glasser came back in the 80s and said, hey, I was wrong. It's not to love other people and receive love in return. It's a sense of belonging. And the heart of belonging is love. Love loves everything. You go back to the rhesus monkey studies, right, where they, took the monkeys from their mothers and gave them fake mothers that dispensed milk, but they didn't have love and affection, and they ended up dying. So love is ultimately our greatest need. And I think that comes in a lot of different forms. So it's not just, husband and wife, or husband and husband, or wife and wife. It's the ability to have love on multiple levels. So C.S. Lewis, people are familiar with them, of course, Screw Tape Letters, talked about 4 Greek words for love. And what's interesting is we're familiar with the first 3. We're familiar with philia love, and we're familiar with agape love, and we're familiar with eros, erotic love. But he also talked about a 4th word, which is storge love, S-T-O-R-G-E. This came from some lectures he did at Oxford. And this 4th Greek word for love actually is in the context of a natural affinity towards another person, just because they too are part of a divine creation. In other words, the first time I met you, Rick Paddock, was in Corpus Christi, and I loved you. Why did I love you? I loved you not in an erotic way, not in a fatherly way, not in a friendship way. I didn't know you. It's the natural affinity of one person towards another person, both because we are part of the divine creation. And that type of storge love, the ability to accept and receive connection with other people, simply in a non-judgmental way, because they too are people, is a profound love that we don't spend enough time talking about. And I think the heart of empathy, the heart of the coaching relationship, the heart, we do this because we love helping people make change and experience success and benefit from the methods we use.
Storge?
S-T-O-R-G-E.
Pronounced storge?
Sure.
Storgy.
I don't speak Greek, only Chinese and Russian.
Okay. I like it. And that kind of comes back around to, I think, what you're saying, that those therapists, all of us, you, myself included, were perhaps in the moment we aren't using the best process, protocol, technique, but change occurs because of that type of love.
Absolutely. I've been doing therapy for 30 years, more than 30 years. I've gone to work and done a bad job. In other words, I had my own problems that were distracting me from my client, or I was tired, or I went to work sick and couldn't devote my full attention, or there are some, we can't always be our best every day. And so there are sometimes I thought to myself, wow, I just did that hypnosis session. That was the worst session I've ever done in my life, right? And 2 days later, the client comes back and I'm like, hey, I still haven't smoked. I feel great. Thank you. You're so awesome. Well, it wasn't because I did a great job. It's because I genuinely actually care about people, and they do that. And so what's love got to do with it?
Everything. So that notice or that alarm that perhaps went off was my assistant sending you an image. It is now time, because of the love that we have for you at the Mind Flipping Institute. You are getting a major award today. So you may see a image there of the major award. It's being mailed to you. You should get a package today, and it may be popping up on your screen. That major award that you're getting is a golden watch. And if it doesn't come up on the screen here shortly, and for those listening to the podcast, you can go to mindflipping.com and you'll see an image or perhaps box opening video of that major award. It's the golden watch because millions of people have watched you on YouTube. It's for your exemplary work on pioneering work, yes, on YouTube, as well as for your love of watches. Will you accept that award?
I do. Thank you very much, Rick. I will save it forever.
Display it prominently in the corner of your closet, please.
I will. Yep, absolutely.
Excellent. Well, as we wrap things up, Richard, is there any requests you have, any last things you'd like to add for our listeners?
No, I encourage everybody, if you are listening and you haven't experienced a hypnotic process, use my self-hypnosis recordings. I got zillions of them on my YouTube channel, lots of them on my blog, and it's a great place to really activate our greatest level of potential and to move into a new chapter of life. And so exploring hypnosis with a hypnotist or with a coach or through the self-help resources that are available is just an excellent tool for all of us.
Fantastic. Great suggestion. Anything coming up that you'd like the listeners to be aware of as we record this in early February of 2018?
Lots of good things are always coming up. Classes that I teach, classes that you teach, and anybody can always contact me and get a schedule of upcoming classes at the clinic here in Nevada, and certainly from Milwaukee Hypnosis as well. So.
Fantastic. I will include links to Hypnosis Nevada, Subliminal Science, and all other things related to Dr. Richard Nongard. Thank you so much for the time and for all that you do, Richard.
All right. Thank you.
You bet.